Every day. Joined now in the studio by GP Dr. Helen Wall. Good morning.
Hi, good morning.
And that's the problem, isn't it? That these things are in every shopping basket, every plate.
It's a minefield, isn't it? Because we've been telling people for a long, long time, you know, reduce your fats, watch out for sugars, watch out for salt in your diet. But this adds a whole new layer to it, doesn't it? Because it's not just fat, sugars and salt. If we saw in the VT, in the study that they've done, they controlled for fat, sugar and salt. So both diets had the equal amounts in. But even then, the amount of processing that had gone on with the food, the emulsifiers, as they said, added that level of detriment to health. So that's the concerning thing. But it is in absolutely everything that we eat, almost, isn't it? So it's so hard.
So what, if you're in the supermarket today doing your shop, what should you be looking out for? Because I imagine it's really difficult if you're cooking for a family or whoever to completely cut this out.
And things have changed, haven't they, so much over time. You know, we're not in the days anymore where people are at home cooking, preparing meals from scratch by and large. And the vast majority of us, both parents, are working long hours. We're in a cost of living crisis. We're trying to juggle lots of things. There's lots of competing priorities right now. And these foods, by and large, are the convenient foods, the ones that you can grab in the corner shop, on your way somewhere else. You don't have to prepare them. So I think, if you're someone at home who's sat there and you've got time to prepare food from scratch and you've got the ability, it's not just time, it's money as well, because you have to look at the difference in price between a bag of processed chicken nuggets and a chicken fillet. They're worlds apart. So there's there's a number of layers to this that are going to impact on people being able to do anything about this. I think it's going to be about the regulators getting a grip on this, really, because it's really hard for the individual, I think, to navigate this unless you are somebody who's got the ability to do that with time and money.
And you mentioned emulsifiers. I mean, emulsifier is one of those words that you see on a packet. I didn't really know what emulsifiers were.
It's like paint, isn't it? Emulsion. It's,
but it's basically the kind of the stuff that glues the ingredients together.
It's a binding agent, isn't it? It mixes it. So it's not a nice thought, is it? And I think there's, said it, isn't it, 60 of these, added to our foods, and apparently more than half of our total calories consumed in the UK by people are in highly processed foods, come from highly processed foods, particularly higher in children and adolescents. And as we heard there, we've got the highest number of obese young people in the whole of Europe. So it is worrying, but I think it's difficult for the individual to do much about this at the minute. It's got to be, as they said, a consultation phase to try and get a grip on this.
OK, let's try and put a slightly positive outlook on this if we can, because the report that we've just shown, suggested that actually it didn't take the twin who was on the ultra-processed diet, it didn't take her very long to turn things back around again. It was like 2 weeks.
Yes.
So it can be fixable.
Yeah, our bodies are really, they're miraculous, really. And things like your liver, we know that can repair itself. If we do make small changes, and there are some small changes that we probably all can make, cost of living and all of that aside, some little swaps. So it's not all processed food is bad. Frozen fruit, frozen veg, tinned veg and fruit, provided it's not in sugary juices, etc., can still be beneficial. In fact, frozen fruit and veg can have more vitamin C in it than if it's been sat on the shelf for a week or two. So, it's about just trying to make little swaps that we can do. But it's hard. I had a patient a couple of weeks ago who didn't have a fridge or an oven, was living from corner shop to mouth with a microwave, and that's the reality of what some people are dealing with right now. So I think if you can make little swaps, get your 5 a day in, fruit and veg, that's a really good start, but it is difficult.
Helen, thank you very much indeed. Thank you for coming in and talking to us. And that panorama that we saw, the clip, Esme's report, that investigation is on tonight. It's called Ultra Processed Food, a Recipe for Ill Health. BBC One, 8 o'clock, will also be on the BBC iPlayer after that.
Do you know what you need?
5 a day.
Yeah? That means some monster strawberries, because strawberry season is here, and this